Hey, everybody. Welcome again to our regularly scheduled research updates for lipedema. I'm Leslyn Keith. I'm with the Lipedema Project and Lipedema Simplified. I'd like to get together with you to go over papers and research and things that have relevance to lipedema. And so I am really excited today that the paper that I'm going to talk to you about is actually one that myself and 9 other colleagues just published. And so the paper is called Proposed Framework for Research Case Definitions of Lipedema. And it just came out in March of 2024. So this paper, which took about, a little over 2 years to write, it was a collaboration between 10 different authors. And 5 of those authors are from the Lipedema Project. It's myself, Dr. Catherine Sayo, Monica Wahi, Siobhan Huggins, and Dr. Matthew Carmody. And then we had the privilege to collaborate with 5 other international authors as well, other experts on lipedema. And so with us on this paper is Dr. Gabrielle Ferber from Germany, Dr. Isabel Forner Cordero from Spain, Dr. Sandro Michelini from Italy, Dr. Stefan Rapprich from Germany, and Dr. Stanley Roxon from the USA. So it's quite a spectacular lineup of authors. And so I think we've come up with a really good design for a research case definition for lipedema. So let me tell you a little bit about the paper and see how it might be of use to you. We will have a link in the comments below, so you can get straight to the paper. It is open access, so that means that you don't have to pay for it or anything like that. You click on the link and you have the full paper. So what was our goal? What were we trying to do with this work? We wanted to propose a framework for the development of a research case definition of lipedema, and that would be based on current literature and our own clinical observations. But what is a case definition? So let me talk about that just a little bit. So a case definition is a set of characteristics or symptoms that can be used to decide if someone has a certain disease or a condition. So it's setting out these certain symptoms and characteristics and saying, okay, this is what defines this particular condition. And when you do a case definition for research specifically, it allows the researchers, when they're putting together a study and they want to have a group, a lipedema group, and they maybe want to have another comparison group that doesn't have lipedema, you got to make sure that everybody you put into that group has lipedema, and you want to make sure everybody you put into the other group doesn't have lipedema. And right now, there's been so many different definitions of what is lipedema, and they have a lot of overlap, of course, but they also have minor differences. And so now you have these researchers use this definition and this criteria to put people into the lipedema group, and these over here use this other set of criteria. And now we are unable to pool the results from all of these different studies that may have been looking at a similar thing. For instance, what's the impact of using a pneumatic compression pump on lipedema? And so if we have different definitions of lipedema in those several studies, we can't pool all the results together and be able to put all that data together and see what the results are. Because if you're using a different definition, you can't put all that stuff together. So, so I wanted to say that the definition is going to look at lipedema, and if we have a standardized way that every research study uses that, then we can aggregate that data. And so it actually helps us deal with some of the pitfalls of lipedema research. Traditionally, the studies in lipedema have been very small numbers. It's hard to get a bunch of patients together to be able to, for instance, you have to come to that research center in order to participate. It's hard to get a bunch of people together that have lipedema and that meet this criteria. We're hoping now, if we have the standardized criteria, then we can pull it all together and we can have a really large sample size. And that means that if we're having a very small sample and they all come from a certain clinic, then can we really generalize out to all patients with lipedema? Or does this really only apply to people who live in this certain region and have had care at this clinic? So it becomes more generalizable if we can pool all these studies together. And it might even make the amount of the treatment, the impact of the treatment might even be more significant when we put more people together, or it might be less significant. We've learned something there too. So let me talk about sensitivity and specificity in research, in having a case definition. This is very important when we're looking at trying to get really good samples, really good groups to test things on. And so sensitivity means the percentage of persons with a disease who are currently identified with the test. And so if we have high sensitivity, then we're going to have a larger pool of people that we can say they all have lipedema. And so someone might not, in this case, if it's highly sensitive, they're not going to fall through the cracks. They might actually have lipedema, but they weren't identified, and then they're not part of the study. Well, if this case definition is high sensitivity, we're going to make sure that we get all those people that may have slipped through the cracks before. And then specificity is a percentage of persons without the disease who are currently excluded from by this test. And that means in past studies, we might have had someone who actually has lymphedema, or they might have actually had obesity, but yet they were identified as having lipedema. And so they shouldn't have been in the in the lipedema group. So with our case definition, we're hoping that we also have high specificity, meaning that if you are not going to be in the lipedema group if you don't have lipedema by our definition. I also should point out too that for the purpose of having this case definition to be used for research, our definition is narrowed to just adult females. And so even though we know that lipedema can occur in males, it can occur in children, the presentation might be different. And so this case definition may not apply to those people who might genuinely have lipedema, but they don't present the same way. So they wouldn't be captured by our definition. So this definition only really works for adult females. So what were our methods? Well, we use Google Scholar, which has been shown in other studies, other meta-analyses, that it really captures all of the literature that's available, that's out there. So we use Google Scholar and we searched under the terms of lipedema, lymphedema, lymphatic disorders, adipose tissue disorders, and obesity. And we want just to capture everything that has come up with those words. And so let me talk about our results and what we came up for this framework. So we wanted to group things into either frequently mentioned and agreed upon in the literature, or other characteristics that were more disputed or they had weak evidence. So, so we found 8 frequently mentioned and agreed upon characteristics. And so the first was it's almost exclusively occurs in females. That was pretty much through every paper and study. A disproportionate distribution of adipose tissue to the lower body, and in some cases to the arms, pretty much in just about every paper. Onset or worsening during periods of hormonal flux like puberty, pregnancy, and perimenopause, very commonly cited. Easy bruising, often reported. Pain, limited or no response to calorie-restricted dieting and exercise. And then also unique tissue and skin alterations were quite often talked about, but not every paper had that. And then also ankle and wrist cuffing, even though that is kind of a tissue uniqueness in lipedema. We felt like it needed, it kind of stood alone as something by itself that we wanted to talk more about. So we made that as a separate characteristic. And then there was 5 characteristics that were either disputed or there was weak evidence for, and so we couldn't have them be part of the case definition requirement in order to be accepted into a study. So someone with lipedema might have these characteristics, but if they didn't have them, it would not exclude them from being part of the study if they met the other criteria. And so the disputed ones were a family history. Sometimes we don't have a family. You might be the only one in your family that has lipedema, but often it does have a family history. And so that goes into the genetics, which there's just not, the evidence is still weak there, but we're exploring. Non-pitting edema coupled with a negative stemmer sign, that means that the feet or hands are not affected. And that's very much a disputed characteristic. And then onset with gynecologic or other surgery. People are talking that this has happened. It's mentioned in literature, but not very much. And so there's not a lot of evidence. It's weak evidence for that. And then the definition of the stages, there's a lot of dispute on the stages. They're not easily identified or demarcated between each stage. And the evidence of disease progression, of the lipedema getting worse over time, that's still a lot of work that needs to be done there. And so we don't want people to be excluded if they don't meet that criteria. And then lastly, circulating biomarkers, meaning blood tests. There is not, the evidence is weak for having a biomarker in the blood. Although that's something that we're interested in, it's not something that you can use conclusively to have someone be a part of a study or not. So then with each characteristic, we looked at the evidence or lack of evidence for each characteristic. And then we also described in the paper how you would assess that. So say you're going to use pain is going to be a criteria for being accepted into a study and being put into the lipedema group. You have to know how to assess that person for pain that is associated with lipedema. So we went through each of the characteristics to say how you would assess for that characteristic. And we realized as we were doing this, even though our primary goal was to help strengthen research in lipedema, this is a valuable tool also for the clinician. So you are seeing somebody, you suspect that they might have lipedema, or you're going to your doctor and hoping that your doctor can diagnose you. Well, this is a tool they can use what we've described as for assessment for each characteristic. And then you might be able to get a diagnosis if your doctor uses these guidelines. So this does have usefulness for a clinician as well. And so ultimately, after assessing all of those characteristics and the evidence or lack of evidence for each, we came up with 10 characteristics, and 5 were absolutely agreed upon. And we felt like these 5 could be used to say whether or not someone would be in the lipedema group in a study. Then the remaining 5 characteristics, so these are ones that had weak evidence or they don't occur in every person with lipedema, but they occur in others. Then we wanted to have those be as an option that can strengthen your choice on whether to put someone into a lipedema group. So the 5 that were absolutely agreed upon were female sex, pain or heightened sensitivity with or without pressure. And we also put that down as current or historical, because some patients with lipedema have been able to find excellent interventions that reduce their pain. And so we feel that if someone has been able to treat their pain, even though they don't currently have pain, historically they did. And so they still would be able to be in the lipedema group because they historically had that lipedema pain. Then we also had another agreed upon characteristic was that disproportionate distribution of fat to the lower body. skin and tissue changes, and we describe those extensively in the paper. And then also the lipedema group would have limited or no response to caloric restriction or exercise regimes. And this one, we have a little asterisk next to it, because if you get a younger person who maybe doesn't have an extensive dieting history, so she is an adult female, she's 18 years old, but she hasn't tried a lot of diets. And so that person may not have that in their history, in their medical history. And so that is not something that would be hard and fast. But if they have any dieting history, typically what we're finding is that person with lipedema has had limited or no response to that low calorie type of dieting. And then the 5 remaining characteristics that we're going to use those to bolster our choice of putting someone or not putting someone into that lipedema group. And so this person, these characteristics are going to be wrist or ankle cuffing. Remember, if your lipedema stops at your elbow or stops at your knee, you're not going to have a cuff or that shoulder of tissue on your ankle or at your wrist. So this is not going to occur for everybody. It doesn't mean if you don't have that cuff, it doesn't mean that you don't have lipedema, right? And then the onset of symptoms or exacerbation of symptoms at puberty, pregnancy, or menopause. Not everybody that happens to. It happens a lot. And the most common that we see in the papers is at puberty. But there are other patients who say that it happens at other times of their life. So we didn't want to make that a criteria that would exclude somebody. And then hereditary, that if you have a lot of women in your family who have the condition or they have the presentation of the condition, that we didn't want to make that a requirement, because there's lots of patients with lipedema that can't think of anyone else in their family. And the easy bruising was not a requirement as well. So then what we did is if you had the 5 agreed upon characteristics: female, pain, disproportionate fat, skin and tissue changes, and non-responsive to diet, that was automatic into that lipedema group if you had those 5. And then we had ways to use that additional evidence, those other characteristics that could also still get you into that group if you didn't have all those 5. But what we said is you had to have at least 3 of the 5, and 2 of those 3 had to be female, and it had to be pain, current or historical. So those 2, and then it could be one or the other. And then we could use some from you had to have a certain number from the additional evidence column to get you into that group, because maybe you didn't have dieting history, maybe you didn't have maybe you were obese, and it was hard to tell that the fat was disproportionate to your lower body, for instance. So we wanted to make sure that we didn't have any people fall through the crack. We wanted to have that specificity. We wanted to have that sensitivity, so that we know we have a really good standardized lipedema group, and also a good standardized non-lipedema group. And so this is what we presented in that paper for you. There are limitations, as there are to any research, and this is a literature review and what we've come up with that. So we're going to have limitations. One is that we identified is that we really are limited by the available literature. A lot of the studies, as I said, were a small sample size. We're not so sure that it was a similar group of patients that were all very similar. Did they all have the same comorbidities, stuff like that? And so it was the research that's out there is weak. And so we're basing our framework on maybe not so good research. And then because there is no blood test, no imaging, nothing that you can do in that way to objectively say this person has lipedema, for that reason, it's impossible to validate this framework. And so for that reason, we designed this framework to be this is not the end of the discussion. This is the beginning of the discussion. We would like people to use this framework going forward when they design a research study. But as we get new information, as we learn more, this framework was going to need to be updated, and not for the least the reason of the potential for bias that we had when we put together this framework. Because and the two types of bias that we looked at was that there's information bias, meaning that every paper that we looked at did not look at every potential characteristic of lipedema. So we couldn't pull information from that. A lot of them just did female pain and disproportionate adipose tissue and didn't talk about any other characteristics of lipedema. And so it makes it very hard to evaluate. So our bias could have been shaped by that. And the other thing is researcher bias. All 10 of us have our own opinions about lipedema. And even though you try to fight against those biases, it is a lot of times unconscious. And that seeps into your thought process and into your writing. So we acknowledge that is also influencing this paper and our conclusions. And so it needs to be something that's going to be looked at in the future and updated and modified and discussed. So we're hoping that people will read this and discuss it with us. This is, I think, going to hopefully be something really valuable that will increase the strength of the scientific evidence about lipedema and help us find better treatments. So thank you very much for listening to me talking about our recently published paper. And I do want to get to some posts, something that are people putting in the chat here. But first, I want to make sure I talk to you about a couple of announcements, because we have a really excellent event coming up on April 12, 13, and 14. It is our next heart-to-heart event. This one is focusing on nutrition. So it's Keto and Beyond, customizing your plan to joyful nutrition. This is an event. It's not just a conference. It's not just a symposium. This is you participating and communicating with the speakers, with the vendors, with all of us organizers. Siobhan Huggins and I were picked out the program and invited speakers. And so we want you to be in a conversation with us as much as you want. And so, yes, there will be speakers, but there will also be opportunities to get into small groups and network with your peers and other people at the event. So click on that information below and come to our event. It's going to be absolutely fabulous. And one thing that's going to be happening there, one speaker that we have is Dr. Georgia Eid. She has recently published a book about diet and mental health. It's Change Your Diet, Change Your Mind. And she is going to be talking about how your diet can influence your mental health. And she's a Harvard-trained psychiatrist. And this is also going to be an opportunity for you not only to hear Georgia, Dr. Eid, talk at our event, but we have a book club at the Lipedema Simplified Tribe, and we're opening it up to everybody to attend on April 9th, 5 p.m. Eastern. We're going to be talking about Dr. Eid's book. The discussion is going to be moderated by Siobhan Huggins. So even if you haven't read the book, come and see how we are in the tribe, how we're one activity that we do in the tribe, which is a book club, and learn about the book. And then you will be able to also see Dr. Eid speak at our event on April 12th. I can't remember if she's going to be there on the 12th, 13th, or 14th, but over that weekend. So see the link below to be able to hook into that event. And you know what? Make it easy on yourself. Look at our calendar of events. And so below we'll have a link to that calendar of events, but also if you just go, and this is something I just learned today, you go to our website, lipedema-simplified.org, and you look up in the top right-hand corner and you will see a button that says calendar. And when you click on that calendar, you immediately get the month and as far back forward or back that you want to look at it. It gives you the event and a link to the event. Most of the events are free. Like for instance, like this one that I do the first and the third Thursday of the month with research updates. So you will have links to all that events, or if it is a paid event, it gives you a link to get more information and to register, like our heart-to-heart event that's coming up. So I'm trying to remember if I talked about everything I'm supposed to talk about. Oh, one more thing before I go on to your questions is that I'd like to put up my email right here, Leslyn at lipedemaproject.org. If you would like to communicate with me, if you have a paper you want me to look at, or you just have a comment or a question related to lipedema or lymphatics, please feel free to contact me. So that's how you get in touch with me, Leslyn at lipedemaproject.org. And now looking through to see a couple of your comments. Thank you for those of you that are posting, even just to say hi. It's so wonderful. Yes, and there has been a couple of comments about the COVID vaccine, and since I would my only comment is that the vaccine is using your immune system to try to help you with COVID, and your lymphatic system is a major part of your immune system. So if you already have a compromised lymphatic system because of lipedema, then you might have a hard time with the vaccine. I don't know your individual situation, and you may have had the vaccine and had no issues at all. So what I would do if you felt like you had an issue that was related to the vaccine, please contact the CDC, because they are collecting information and data on adverse effects. So they want to know about it. And of course, you should be talking to your physician as well to see if there's anything that you need to be doing as far as treatment. Sometimes it's very, very hard to know if something is related to a particular action that you took. So, and then Sing It says, hi from Chicago. Yes, and also this person is saying that there is some of the characteristics in their lipedema, but not some of the others. So, and that's the type of thing we want to make sure that we capture every person who has lipedema, that they're allowed to be in that lipedema arm of the study. We don't want them excluded because they don't have every characteristic. Very good. Charlie horses in the inner thighs and bottoms of the feet can be associated with lipedema. Yes, it can. We didn't include something like that in the case definition, but it might be bundled into pain that you're experiencing. And so a Charlie horse and cramping in your muscles might be something that is associated with lipedema, and it would be captured just by that pain criteria. So that is very good. And so people were giving some suggestions on things to try. That's always good. The community is always very helpful. People were saying magnesium might help with cramping. And also Winetta said horse chestnut gel might help. So something good to look at. And looking down further to see if I have any others. Hi, Marcia from Texas. And another Facebook user from Wisconsin. And all the nodules, round like peas, can they be lumpy in the chest? And the rest of the chest area is a ropey feeling. Is this common in lipedema? So one of the unique skin and tissue changes we talk about are those fat nodules. Typically, they would not be in the trunk, but they would be in the affected lower body and sometimes in the upper arms. But I can't rule out that something that's happening as part of your lipedema in your lower body might also appear in other tissues of your body as well. And there are other conditions that also have that as a characteristic. For instance, Derkham's has those fatty, hard, sometimes painful, often painful nodules. with DIRCMs are often painful, and with lipedema, they're not always painful. So it's really important to go to, hopefully, if you can see a physician that's knowledgeable about lipedema and have them assess for you what they feel like this is part of lipedema, this is maybe another condition or not. So excellent question. And Martha is saying that she gets cramps in her arm. So, and that could be part of your lipedema, might be related to something else. And Marcia, I would suggest you take some of those, try out some of those suggestions. They seem like they would be benign enough to try. Magnesium can be taken either orally, or there's magnesium lotions. And then the horse chestnut gel, of course, is another topical that you could try. So, wow, this time went by so fast. You guys are so wonderful to be here with me today. I really enjoyed discussing with you, and I'm so pleased that our paper was published, and I'm hoping that it's going to have an impact on the research for lipedema, and that we will learn more. If you would like to help with research with lipedema, be sure to go to our lipedemaproject.org and donate, because that's what we use our donations for, to help with research for lipedema. And thank you for being here. I'll see you next time.